Hello, my name is Sabrina Kurtz-Rossi, and I'd like to welcome you to Patient-Provider Communication, a health literacy micro-lecture. In this micro-lecture, I'm going to focus on practical strategies to improve communication, but not only focused on patients and providers, but anyone who's communicating health information. Okay, to begin, really want to make the point that health literacy is a two-way street, and to improve communication, we address this issue in two ways. One is to increase the health literacy of individuals, families, and communities, and the other is to increase the health literacy or health communication skills of health professionals and to create health literate organizations. In this particular lecture, I'm really going to focus on the health communication skills of health professionals. To create health literate organizations, we've got the 10 attributes of a health literate healthcare organization, and attribute 3 is to prepare the workforce, and that's the health professional workforce. So one of the first strategies is basic strategy to avoid jargon. We use a lot of jargon in communicating health information. Words that people don't use in everyday life. So words like anti-inflammatory. If I was sitting in my living room and talking to my kids, I wouldn't say anti-inflammatory. I might say this medicine will help lower your fever or reduce swelling. Nasal congestion is another one. I would use the word stuffy nose, perhaps, if I was talking to my kids or my family members. There are a lot of words that we use. Hypertension is another one. I was actually sitting at the dinner table talking to my family about what I do, and I was using the example of hypertension, thinking, oh, everyone knows what hypertension means. But again, no. High blood pressure. So thinking about the common everyday words that people use, avoiding jargon. And the other thing is to avoid acronyms. We use a lot of acronyms, abbreviations, and even the other professionals that we work with, the interdisciplinary teams, don't know the acronyms that we're using. So number 1, avoid jargon, avoid acronyms. Number 2, encourage questions in a shame-free environment. So really encourage any kinds of questions. What is my problem? What should I do about it? And then engage all the staff or all the folks that you work with. If you're working in an office environment, there's the front desk. There's also folks who work the building that may be looking for directions. So again, create a shame-free environment and encourage questions. A way to encourage questions is to use open-ended questions. So we often end in interaction or teaching engagement with the question, do you have any questions? That's so common. Do you have any questions? And we often even shake our heads. Do you have any questions? No, you're not encouraging questions. We want to encourage questions, and open-ended questions really help to do that. Questions like, very simply, what questions do you have? It's an expectation that you have questions. This doctor right here has a great example of encouraging questions. She actually demonstrates the teach-back method, a way of teaching information and then asking in a shame-free way for the person who you are working with to explain back to you what they understood you to be teaching. Drawing from the cultural competency literature and evidence-based approaches, provide language assistance. So use interpreters and translation. So interpreters, oral interpretation, work with an interpreter, or use translated materials that are written in other languages. So if you're working with folks who don't speak English as their first language, use language assistance, work with an interpreter, use translated materials. Speaking of materials, use plain language materials. So materials that are easy to read, materials that use images that are relevant to the people that you're working with, that use vocabulary and common everyday language, that limit the information. So in your education, you want to limit the information that you're providing or that you're emphasizing to really the need to know. So focus on the need to know information. Your materials also should be limited and not extensive, really focused on the information that's relevant to the people that you're working with. And then break up complex information into chunks. This is called chunking. Materials, plain language materials are very good at this. If you find good plain language materials that have headers and chunk the information in small, digestible amounts. And then kind of moving on to the other side of the equation in terms of improving the health literacy of the community, individuals, families, and communities, link up with adult education programs. Work with community organizations. Adult education programs are in your community and they are there teaching and supporting people in everyday life, which includes accessing health information and health care. And then partnering with librarians and teachers. Again, librarians could be the librarians within a healthcare facility that are doing consumer health, and you can actually prescribe or recommend that someone go and find out more information. Go to the librarian within your health complex, or go to the public librarian. In fact, health information is one of the top questions librarians in public libraries get from patrons, questions about their health. And the other is searching the internet. This is done in K through 12. We're teaching our children to search the internet, and there are programs as well, oftentimes in libraries, that do community education, also in adult education programs that teach people how to search the internet for accurate and reliable information. And if you're concerned about the type of information people are going to come back with, recommend accurate and reliable websites for them to go to. And then finally, to conclude, key points. From my perspective, the key takeaways from this micro lecture are to avoid jargon, create shame-free environments, ask the question, what questions do you have? Use easy-to-read materials and link with adult education programs. So my question to you is, what are your key takeaways? What did I talk about in this micro lecture that refers or relates to your work, and what questions do you still have?